Hi, Kristin Snowden.
Hello. Good morning, everyone. My name is Kristin. I'm a licensed marriage and family therapist in the state of California and certified life coach. I run webinars kind of talking about and focusing in on relationship struggles. So from the very extreme where there's addiction and an extreme and consistent and chronic infidelity, lots of lying, double lives going on, all the way down to the trickling of just the more common issues that come up during the lifetime of a relationship. And when I say relationship, it's not always just within a primary romantic relationship. It also can be the communication and the feelings and the shame and the hurt that gets exchanged in a parent-child relationship, family members, coworkers, etc. So thanks for joining me today. Today, we are going to be talking about helping you understand the ins and outs and navigating where to get help. We have so many people writing sexandrelationshiphealing.com. They're coming to my website. Everyone is in a state of struggle right now. And there are many options for where to get help out there right now. Many of you are getting help, which is why you found this website, which is great. But many of you don't even know where to begin, how to get the help you need, etc. Or even, I think as clinicians ourselves, we take for granted the idea that you automatically know who we are, what our qualifications are, etc. And so I want to take the opportunity to kind of explain that to you. So first and foremost, let's talk about like mental health clinicians. There's lots of different names. Every single state has different names for mental health professionals. So in the state of California, and I see different letters after people's names from other states, so I'm not going to pretend like I know other states' licensing. So I'll mainly focus on what I know in California. There's licensed clinical social workers, there's a licensed marriage and family therapists, there are people who are considered psychologists because they have a doctorate. So LCSWs and LMFTs have master's degrees and they've gone through thousands of hours of licensing. And then there's also people who've gotten PhDs or PsyDs, so doctorates, and they've also gone through a ton of hours and licensing, and they're regulated, and we have continuing education and all that kind of stuff. We're strongly, strongly regulated, especially in the state of California. There's also a thing called life coaches. If you heard me say it in my introduction, I'm a certified life coach. Those are not regulated. So in the states, any of the nations, any of our states, there is no regulation system. So there's no board that's kind of regulating the minimum requirements of education and minimum requirements of hours and exams. So anyone that has a life coach certification usually has like a independent program that they're certified under, some kind of program. They are they're the board that overrides it and regulates it. So I always encourage people to kind of ask if they're certified life coaches, what's their background, like what's their experience that qualifies them to speak on this particular topic. So LCSWs, LMFTs, psychologists as well, PhDs, they all are allowed to be practicing. Oh, and the other issue too is that a lot of those state regulated licenses usually are qualified for you to get insurance reimbursement for it. So I'll get a lot of people who will say, hey, do you take this insurance? Do you take that insurance? And first of all, if they're out of state, I can't even see that person as a licensed therapist because my license is to the state of California. And so if they want insurance, they have to find somebody within their own state in order that is, takes their insurance, that's on their insurance panel. So I'm just trying to help you guys figure that out because a lot of people who are in crisis, money's tight and they can't necessarily pay cash. And so one of the requirements is if, they need to go through insurance, they have to find somebody local or at least within their state boundaries, because that will allow them to be using their license in order to get the reimbursement. So I hope that gives some qualification for all of you. Other a professional, mental health professional that you probably know of is a psychiatrist. So a psychiatrist is not a psychologist, it's not a therapist, it's not a me. They are medical doctors. So they are licensed under, they are basically licensed medical doctors, but they have a specialty. They did their residency in a psychiatric environment. So their main purpose is to assess, diagnose, and prescribe what we call psychotropic medication, right? So a licensed marriage and family therapist or like a psychologist, you can go to them and they can diagnose you with, addictive type tendencies or depression or anxiety, or even let's say schizophrenia. And then a psychiatrist would be the one that would be prescribing you medication. The caveat to that is these days, general practitioners, so just even your home doctor, sometimes will be the one that will prescribe you. So you'll go in for like a checkup and say, I just found out my husband's cheating on me. I'm not sleeping at night. I have ruminating thoughts. I'm highly anxious. Can you give me something? And oftentimes your general practitioner will prescribe you some kind of medication. That's above my pay grade and above my licensing. But I also know that psychiatrists, at my treatment center, for instance, their entire education and purpose is finding out the newest, most recent psychotropic medications, the cutting edge. Our psychiatrists give genetic workup. So they test their genes to find out how their genes are going to respond to particular types of psychotropic medication. So if your intentions are to use a psychotropic medication for a long term, you might as well go to someone who's kind of an expert in it, so to speak. That's my 2 cents. I mean, I'm not licensed in that world, but that's my 2 cents. Another topic that usually falls under relationship crisis, or another professional that tends to fall or come with relationship crisis, are attorneys. So divorce attorneys, attorneys involved in custody battles, custodial stuff. Those obviously licensed mental health professionals and licensed psychiatrists or life coaches are not held or understand or are licensed to ever give any kind of legal advice. Attorneys are, officially, they wear their hat in order to, zealously defend their clients' particular needs, and they have their own specific purpose. So we all are supposed to kind of stay on our side of the street, appreciate another professional's wearing their hat and how they contribute to the process. So just be careful of people who try to transfer their expertise into it. I mean, maybe someone who's gone through a divorce, who's like a licensed therapist, might be able to speak from experience how their legal experience was, but they're not an attorney, so they can't give you legal advice of any kind. So when searching for therapists, and again, this is just my opinion, but it's just also my experience, and I have experience working in all things from private practice to outpatient programs to inpatient programs, and I'm going to define all of those for you. But I actually find there's a strong importance for someone to get help from someone who has a specialty in it. I guess a really quick equivalent is you wouldn't take your Mercedes to a Maserati dealer, or you wouldn't take your Honda to a different dealer. It's always helpful when they have the software, they have the training, they have the equipment to properly and probably more effectively and efficiently assess the problems and treat them. So I always really strongly urge when people come seek me out and ask for help, I encourage them, if they're finding me and the betrayal trauma concepts really speak to them, then please seek out somebody. There's no official, I'm not a certified betrayal trauma therapist, right? I don't have a special name to it. But what I guess qualifies me to be experienced in that is my years of working in sex addiction and partners who are with sex addicts, chronic infidelity, single experiences of infidelity, families and loved ones uncovering these secret affairs or secret addictions, and the extreme devastation that betrayal, how it impacts them so negatively. So I would definitely want to find out what these therapists, psychologists, etc., what their specialties are, and ask them. And this is a really big, important topic. This is my opinion. If a professional cannot give you 10, 15 minutes to return a phone call or return an email and allow you to ask a few questions to better assess if that person is a good fit, if they have the right training and experience that you're looking for, maybe even an understanding of, okay, this is the crisis that's going on. This is the way I would respond to it. These are some of the steps that I take. This is my experience with this. I would move on to another therapist. That's just my opinion. I think everyone should have a few minutes to be able to ask some really important questions. You're seeking these people out in a time of crisis. And, sometimes you only get one shot at these crises kind of management experiences. You want to make sure you have a good, help navigator to move you along through that. So that's also why I send a lot of people to Tammy, because I know Tammy has a really great referral base of tried and true therapists that have shown that they know what they're talking about. They continue education in this topic, and they're very passionate about learning more and growing on this subject matter. So let's talk about the levels of care. A lot of you who are chiming in are probably in some kind of level of crisis. And there's always the big resounding question of, where should we get help? What level of care or help do we need? So let's talk about the levels of care. I guess the lowest level of care is what we call outpatient or private practice care. So those are the therapists, in the nice offices, so to speak, and you come and see them for 1 hour a week, or sometimes 2 1-hour-a-week sessions. It's considered the lowest level of care because, as you can imagine, in the state of like a crisis, like let's say you just found out there was infidelity, or you just uncovered an addiction, or you're at the brink of divorce, walking into an office 1 hour a week is usually not going to cut it. So often I consider private practice more like a maintenance of helping you stay stable and accountable to your growing process, not crisis management. But again, that's my opinion. So I think more for a crisis issue, that's not maybe a life-threatening issue, like this person is going to be arrested or get in a car accident or has life-threatening substance abuse issues, or there's domestic violence, physical violence concerns. So those immediate life-threatening issues, there are intensives, or there's also people will combine outpatient with group work or workshop work. So sexandrelationshiphealing.com is a perfect example. They have men's workshops where they're working on a very concrete, structured process of understanding their recovery path. And so they could be going to that, is it 1 time a week, I think? Or is it, yeah, so 1 time a week. And then they can be going to 12-step meetings to get other support or have a sponsor they're doing work with. And then they can maybe doing outpatient work with a therapist to complement and enrich that process. Because that also could be used as, maybe comes up that he or she has a lot of child abuse or child trauma, that a therapist might be specially trained to go into attachment trauma, EMDR, somatic experiencing, some kind of evidence-based trauma treatment and specialty that is you'll only find like licensed therapists or psychologists who can do that kind of stuff. So you see how those things can kind of complement one or the other. So there's the outpatients, private practice, 1 or 2 times a week. Then there's the intensives. So I get a lot of clients who are, I just found out my partner's cheating. I think we're going to get divorced. They want to maybe do like a weekend intensive or a couple day intensive and assess the viability of the marriage. maybe work towards a disclosure of some kind. That's basically when you work towards kind of telling the betrayed partner, you give them a timeline of how you've acted out and what you've done, so you can start moving towards trust and reconciliation again. And then let me think what else. So intensives, right? So there's those 5-day-a-week intensives, there's 2-week intensives, but it's basically you spend a couple hours a day in an intense period of time to really deal with a major crisis issue. Assess, addiction, how bad is it? What kind of level of care do we need to go to from this point? So outpatient, intensive, workshops and groups. And then there's also intensive outpatient programs. So IOPs and partial hospitalization programs, those are called PHPs. So I'm going to call them IOPs and PHPs. These are, well, just so you know, these tend to be a lot more successful programs recently because they tend to be more insurance driven. I'm just giving you the honest truth, the transparent truth, is that a lot of IOPs and partial hospitalizations exist because insurance companies are more likely to pay for that level of care first. It tends to be less expensive. So if you have an initial addiction or marital issues or extreme trauma or extreme depression and anxiety, they're going to first often authorize intensive outpatient before they move on to a higher level of care, which is residential treatment. So IOPs and PHPs have varied schedules. Sometimes they meet about 3 hours a day. Sometimes they meet 5 hours a day. Sometimes people will stay at a sober living or like a halfway house or a house outside of their home while they're going to these IOPs and PHPs. In fact, that's Seeking Integrity's. Oh, it's not? Okay, so it's different now. Okay. And they'll go into, the idea is that they'll be with their cohort. They'll get to kind of blend with their cohort and do groups, do individual, do trauma work, do neurofeedback, do all these kind of really intense work, but you might also have a job, so you need to just do an after work IOP, or sometimes IOPs and PHPs are stuff that you do after residential. So the next level of care is residential, so that your behaviors, your mental health state is so crisis and is in such a concerning state that you need to leave your environment to get healthier. So that's where I work. I work at a Malibu residential treatment center, and these people come from all over the world, and they stay 30 to 45 to 60 to 90 days. There's licensing for substance abuse. So there's some houses that focus solely, first and foremost, on addiction and then deal with trauma issues or mental health struggles such as anxiety, depression, let's even say borderline personality disorder, narcissism, sometimes schizophrenia or psychosis, but that depends. And those people get help for a long term because they're being overseen by a staff. They're getting daily or regular visits with doctors trying to assess their medication. They're getting oversight with nurses, lots of one-on-one time with therapists, lots of group time. Often their meals are made for them. So it's kind of a place where all they have to do is just focus on getting better. And then the higher level version of that, which is kind of basically considered, at least in California, the highest level of care where you could be at when someone's in the most extreme state, is a psychiatric hold. So in a locked unit. So in the state of California, we have things that are called 5150s, which is that basically you're a danger to yourself or others because you have attempted suicide, but failed, expressed a very extreme need to commit suicide or harm yourself, your mental health state, such as you're so psychotic that you cannot care for yourself or you're a danger to others. And that can also be psychosis triggered by substances. And often those locked psychiatric units will have, at least the one I've worked at one for a while. They also had a detox unit, which is not locked, but it was just basically substance users would first go there to healthily and safely and medically detox off of their alcohol or their drugs. Opiates have really can be deadly withdrawals, really uncomfortable. Alcohol often can be a deadly process of withdrawing from it. So psychiatric holds and detox facilities are essentially not really focused on mental health. There's some mental health components to it, but they're there for sometimes only 3 days, 4 days. And the sole purpose is to just give them medical care, some mental health support, and just getting them to a safe, stable state so they can move them on to an intensive outpatient program, partial hospitalization, residential treatment, etc. So those are kind of, at least in the state of California, and I don't think there's other kind of random things. There's like these wilderness boot camps that you've heard of where kids kind of get sent off to go camp and get off drugs and get their lives in order. There's other types of treatment, and maybe Tammy can kind of add, because A, she's in a different state, and B, you've been in the treatment world for a really long time too. But those are your that is your catalog of ways when you're like, my life is not working right now. I'm extremely depressed. I'm extremely anxious. I can't do this on my own. Those are your various catalog options to get help for yourself, for your children, for your family, as a couple, etc. And then go for it, Tammy. What do you have to add?
Well, so I really appreciate your kind of picking this all apart, because I answer the phone, and we have people that are blindsided by addiction, and they're going, I don't even know where to start. So one of the things on sexandrelationshiphealing.com we've tried to do is have resources to help educate people as to what they're really dealing with. So but when you talked about the states, people go, well, everything's on Zoom now, but you are correct, they still have to operate within their state licensure. So you're in California right now. You could work with any clients who are in California under your state licensure, and more than just for insurance purposes, it's for your licensure. At some point, right now things are a little more lax because of COVID, but at some point somebody's going to, get hurt, or something's going to happen, and there's going to be a lawsuit. So for the therapists, it's imperative that they follow their state licensure. You also talked about coaching. I think coaching can be great, and a very supplemental thing. I really love it when therapists and coaches are working together. Again, as you said, a lot of it is not regulated, but even with licensure, the various states have different requirements. So, a marriage and family therapist, the training may be very similar in Florida, California, New York, whatever. But, what they're required to do to maintain the licensure varies from state to state. It's crazy, how much difference there is. And there's not reciprocity where, they can just, well, I'm licensed in California, so therefore I can work in Arizona. No, that's not how it works. So it's complicated. It's a broken system. There's politics behind it. No one's ever going to fix that. So you, as consumers, being educated as to what your therapist has, what your professional that you're reaching out to, what their credentials are, what their background is really, buyer be smart, so coaching, I really see that as, you're here and I'm going to work with you on skills to move forward. Therapists are the ones that can help dig into the old trauma and things like that. And like you said, therapists have thousands of hours of, practical, overseen experience. There's internships, so there's all of this work. So they've worked really hard at being professionals. But like you said, you use the car analogy. I use my doctor. I go to my GP for basic things, basic healthcare. When I had sinus surgery, I went to the specialist. He's messing with my face. He's messing with my stuff. Right. I wanted the guy who knew what he was doing with that, not just my general doctor that's going, well, I could do that, And so I think it's really important. And I get very concerned with GPs or anybody who's just going, here, take this prescription,
Right.
You don't know how your body's going to react to it. I'm aware of that genetic testing. I think it's amazing because if my metabolism absorbs things far more slowly, I need it. Sorry. I need a different medication than somebody who has, a quicker uptake on that. So, or a different dosing or whatever. I mean, there's so many nuances and, it's just a reality, but a doctor goes, well, I've had really good use of this prescription, or the prescription drug companies, make it, whatever. There's
so it's influence there.
Yes. So here's the one I use all the time with everybody, and everybody gets the same thing. And that doesn't take the individuality.
And I understand, like, I'm not going to lie and pretend that like a CSAT, a certified sex addiction therapist, can often be more expensive than, let's say, just a basic licensed marriage and family therapist. That's because they've poured thousands and thousands and thousands of dollars into their certification process. It's expensive. But I will say, I've been to a bunch of different therapists, and there is almost like an efficiency that happens when it's someone who looks through the lens of that more specific, specialized certification versus like a general practitioner or a general therapist, right? They're going to look through mood disorders and depression and anxiety and healthy communication and boundaries, and completely ignore that my husband's been, I'm making this up, but like snorting coke and having sex with prostitutes. Like, there's a reason why I'm really depressed and anxious. And if we don't if we're not trained to ask the right questions and kind of smell the bullshit, then the process is going to be even longer, and it's kind of wasted money. But that's my opinion.
Wasted money, but also additional pain. So you're dealing with your husband who's snorting coke, and so you're on some, like, you're calmer because you're on some medication, but all the chaos is still happening. So Dr. Rob it does 90-minute consultations. They're expert consultations. They're a higher price. It's a one-shot thing, and it's not for everybody. But he had a couple, I don't know, a month and a half ago or so, and they'd been to 4 different therapists over the past 2 years. 4 therapists, and so in 2 years. And it's longer, but in the 2 years they've been trying to get it figured out, and in 90 minutes, because this is what he does, and he's really good at assessing, he was able to discern what was going on, their issues, and give them a path going forward. Worth the money every cent, because now they're on now they have a solution. It's not going to fix everything, but they have a plan. So I 100% agree. Get the right fit. I can't tell you how many times I hear, he's working with a general therapist, and he likes his therapist. And I'm not being sexist. I just answer the phone more with female partners and male addicts. So I'm just using that for general purposes. But and they're like, he likes his therapist, but the therapist doesn't talk about addiction. He isn't holding them accountable, isn't doing cognitive behavioral therapy. The behavior hasn't stopped. So they're 2 years in, and the addict is going to a therapist once a week, likes his therapist, and probably is talking about the chaos of the past week, for the 50 minutes, and that's it. So how are you ever going to address those underlying issues that are the reason why the symptoms, the acting out, are happening? So I'm like, well, they're going to be in the rinse repeat, because it's just going to keep going on and on and on. And that's tragic and unnecessary. Getting the right help really makes a difference. So you mentioned attorneys, and yes, getting the right attorney. And I unfortunately have heard about, therapists that are recommending attorneys, because, and vice versa. So like, it is really challenging, and everybody does need to stay in their lane. And then seeking integrity. So we are a residential program. Okay. And though the house is separate from where the office is, so they call it Florida model, it's irrelevant, but it's, like, the technology is gone for 72 hours. It's, there's an awake tech all the time. unfortunately with most sober livings, because we've had clients before they arrived that were, staying in those, and it's a kind of and it's not true for all of them, but for many of them, it's kind of a free for all. It's like they can go out and they can come back, there's curfew at 11 o'clock, but who knows what they're doing, on that, unspecified time. So,
can we talk about that? Can we talk about
yes,
sober living for a minute? Okay.
please.
Just so you guys also know, sober living is also unregulated. So I could turn my home into a sober living home today. So if your partner or you are headed to a sober living, it's extremely important that you ask, even though it's unregulated, there's some other kind of little certifications and I don't know, communities, I guess, that approve certain sober livings. I'd even say maybe seek out residential treatment centers or PHPs and find out who they refer their clients to. Because all sober livings are not created equal, and you want to make sure they're highly structured, highly supervised. What are the requirements? What are the conditions that you get kicked out of sober living for? Because the people that are going into sober living need that. Absolutely. And by the way, I say sober living, but there's also people who come out of treatment with a lot of depression, anxiety, and so not really identifying as an addict, but still they're appropriate for sober living because they're not quite ready to go back home. They still need a lot of structuralized kind of oversight in their recovery, and that they're kind of getting up and doing what they're supposed to be doing. And that's what those type of sober livings are for.
A good sober living, yes, is that next step and gives them structure. But there's a lot of them that are just, kind of a place to park someone, and during COVID and there's no regulations on, so yeah, do your homework.
Homework.
But sorry.
You're
Jeepers.
so popular.
This has been crazy. So, but but our program, we do a high level of assessment. They are with us, they're cocooned in this space. So, and we have lots of people who have tried other programs. So, sure, try that, the IOP, PHP, try those levels. We don't always get people in crisis. We often do, but some people are just like, I can't stop this. It's been like, I've been dealing with this, and I do pretty good for a while, and then I relapse. So, when they're ready to address the underlying issues, stop the behavior, of course, and then address the underlying issues. That's what we're great at, where, we can, we have the clinical expertise to be able to really hone in on that, because I've said it to a number of people, if we're not your first treatment center, we want to be your last. We don't want it to be, I hate for the addicts. I hate for the partners, when they're going like, he's been to, 3 treatment centers and we've been dealing with this for, 4 years or whatever. I mean, that breaks my heart. And so, but it doesn't have to be that way if you get the right level of help. So if what you're doing now isn't working, Dr. Rob says this all the time, up the level of help,
Exactly.
and then,
right.
then up the level of help, just, keep going up the stairs.
So if you, let's say you unravel, a lot of this is the way it happens, right? People will unravel that there's this secret addiction or an affair, or are we getting divorced or not? And they'll start with outpatient, because that's just the most common accessible way that we think of when we think couples counseling. But if the pattern continues, stop putting your money into outpatient care. There's got to be, and this sounds, I don't know, not exactly the way I mean it, but there's consequences to okay, while we've been trying to assess the viability of our marriage, I just found more text messages of my husband continuing to talk to an affair partner, or my wife emailing so-and-so, that there's got to be an up level of care. So maybe that person needs to seek out support groups, 12 steps, continue to do some work on his or her own to keep his side of the street clean. I mean, something Dr. Rob and I'm hoping to set up a podcast with him, is what's come up a lot in my treatment center is that people will come first and foremost to get treatment for their own, suicidality, depression, anxiety. Once I run a lot of my groups and individual sessions on topics of betrayal trauma and infidelity and how that impacts your nervous system and your ability to relate and feel intimate with your partner and how that impacts your mood, it's kind of come out that it's like, oh, well, my partner's been cheating on me for the past 10 years. And I kind of want to be like, yeah, no wonder you're suicidal and depressed and anxious constantly. And so Dr. Rob and I was hoping to have a discussion to just kind of like, once you figure all this out, what's mine to deal with? What's mine to kind of clean up and work on? And what's my growth pattern and process and path? And then what's my partner's? Because it can get convoluted and there's lots of different options. Lots of people will tell you different things. But I think I have my own very specific opinion about how it should be done.
And yes, and so many people go to couples therapy thinking, we're going to fix our relationship. And I'm like, if there's active addiction, a couples therapist can hold the space for the relationship, and give you some tools to, navigate communication, et cetera. But if there's active addiction, you can't trust someone who's lying and acting out, So if a relationship is built on trust, how are you ever going to have that? So then, healthy boundaries, all of those things. But, I really advocate for partners getting support. They aren't, they aren't codependent. They aren't, they need support. They're traumatized. I want to give them tools to do that. In fact, I've had a number of people lately whose therapists are telling them they're codependent. And I say on page 75 of Prodependence, please say, here's the words I'd like you to use to help me and to help this relationship move forward, because, it shifts things. But getting the right help, again, so, I'm so glad you've got groups for people, and including starting a partners group in October. We've got a couples workshop that is going to start in November. That will be, a series like the work group for men. This will be a series that will be lectures for couples that will, have some interactive, but, very specific purposes, very specific topics. That's one level of help. That is not going to completely fix the relationship, but it will give guidance and opportunities. So, we try to have some things that will be useful, in navigating moving forward. With the work group, though, that you mentioned, which is, that's a great first step. But we're constantly saying, take this to your therapist.
It's not enough.
Yeah, right. Yeah, like
it's just a complement treatment.
Yes. And, because it's like, I'll say, have you read, Sex Addiction 101? And they'll, I have the book. Okay, well, having it and reading it and doing it are completely different things. So it's a structured support to work through that. And that's, all of this, it's because no one gets in a relationship thinking they're going to have to deal with this stuff. So, we want to hold your hands and help guide you through the process and help you get to the right, right resources. I've had people that have called and, I'm like, if we're not the right help, I just hope that they get the right help. We only work with men with sex addiction, intimacy disorders, or co-occurring sex addiction and chemical dependency. That's what our treatment program is. So, if somebody is a sex offender, I refer out, if, like you said, high acuity mental health, refer out, female, young kid, if they're in the kid, like you talked about the outdoor programs and things like that. Some of that is a fit, but there's some other we try to give people the resources so that they can be successful in recovery, so that they and their loved ones aren't on, on that vicious circle of it's painful. And, I hate hearing partners that are going like, it's been 5 years. And I'm like, he hasn't gotten enough help, and they're still sitting there going, I had yet another discovery. I'm like, he hasn't gotten the right amount of help, because it doesn't have to be that way. So,
exactly. And I want everyone that's here, chime in, let me know what's worked for you. Ask me any questions. It doesn't necessarily have to be about asking for help or what's the next best step. If you have more questions about what's the right next step for treatment or referrals or resources, I try my best to send a ton of resources towards you. And again, it's not just for sex addiction. It's also for infidelity. Just there's cheating or inappropriate behavior going on. There's some pornography use that seems to be an unhealthy pattern. I work with substance abuse and also general, more common marital issues of hurt, betrayal, poor communication, shame, vulnerability, and intimacy issues, etc. And also to meet a demand of higher, I've been getting a lot more email recently. I have a current workshop that's going on, but I'm also going to be launching a workshop specifically for betrayed partners. So that would include people who just uncovered an addiction, substance addiction, etc., where there was a period of time where the partner has lived a different life. They uncovered things that they weren't expecting, that they've been shocked to find out, and their heads are reeling and they don't know which way is up or down. I just got a email today about someone's been searching for that kind of help since April, and they haven't been able to find the right therapist in their area. So places like sexandrelationshiphealing.com, I have a lot of resources. There's workshops, etc. We are here to help you. You should not do this alone. You probably cannot do this alone, and we're here to help you. It's my passion. It's what I love, and I want to see if I can help give you the language of the stuff that's been so intangible and so hard for you to grab at, especially when your neurobiology is just thrown into a tornado because your whole world's been turned upside down. So go ahead and chime in and let me know.
So this person said, my spouse is getting multi-level help for SA. That's great. And, and if that's working, that's fantastic. It's, but that's what it takes. I was on the webinar the other day, and I say this anyway, but if you are not pursuing your recovery with the same energy that you pursued your addiction, it's a problem. I mean, because in our addiction, trust me, we're thinking about it, we're planning it, we're doing it, we're
right.
thinking about after, fantasizing about it. So like many hours a day. One of my colleagues was talking about, I had 2 full-time jobs. One was my job, and then one was my addiction. And so, you get into recovery, and all of a sudden you have all this spare time because, you're not doing that all the time. So getting help, being committed to, not everybody can or needs to come to treatment, but, and I was talking to a partner, someone, her husband came to treatment, and he chose not to do anything, like packed up his books, was like that's it, and refuses to do anything that was on his aftercare plan. So, the prognosis is very poor.
Right.
But I said, what a waste. Cause I get calls all the time from people that are going, do you have a scholarship? Do you have I really, really, really want treatment, but I can't afford it. And which is why we have all the free resources, but and then this person has the opportunity for treatment and doesn't take advantage of continuing the recovery process, after completing that. So sad.
Yeah.
So this says, my spouse is getting multi-level help with SA. He's doing well. That's fantastic. I realize now that the waters are fairly calm. My stuff is coming up. Oh, that makes sense. Triggers and trying to rebuild my trust to be intimate with my spouse. I had a meeting a little bit ago, and I was like, one of the topics is intimacy, because everybody automatically assumes intimacy is sex. And we talk about intimacy in a way more holistic manner, but I assume you're talking about that. But also my lack of self-esteem that I feel tipped over by being around my spouse versus everyday life. I'm self-conscious around him and don't want to be naked or intimate with him because I think he looks and thinks outside, but comes home to me to be with me. I'm tired of feeling this way. Logically, I know better. He's trying, he's working hard. Thoughts?
The most prevalent thing that comes to my mind is this is extremely normal. This is a process. So I don't say that to make you feel overwhelmed. I say that to let you know that you're moving appropriately down a very common path, and there is a way through it. It's common. Someone I know was just talking about repairing a relationship with their partner. He's a sex addict. They tried like a year ago. It didn't work. They're trying again. And she's just like, I'm not attracted to him. I have no desire to like touch him. And I just kind of said, well, of course, like that you've not seen enough change. Your brain, look, this has to do with addiction and for betrayed partners. The brain, I was listening to this really interesting neuroscientist talking about how the brain changes, especially changing under stress. And it's, as you know, a child's brain extremely plastic. It can receive information at amazing levels, but an adult's brain, it can change, but you just have to work even harder. And the scientist was basically saying two things are required, which is like a kind of stressed, hyper-focused state. It has to be a high focus of engagement, and then allow this kind of level of, they need like an acetylcholine kind of piece to it that allows you to hyper focus that that's happening. So let's say the addict and you are used to very basic patterns, which is he feels really uncomfortable. He doesn't know how to locate his feelings or identify them. He doesn't have healthy coping skills. So he used to go out and act out to manage that, to regulate his neurobiology. You always had this underlying experience that this man is not telling me the truth. There's lies. I can't feel safe with this person. They'd rather be with another person than me. They don't find me attractive. This is our hard wiring. This is what is first and foremost. Our brain is lazy, and it likes it to just be a kind of reflective experience, like automatically, this person equals, he's not attracted to me, he'd rather be with someone else. That is the tape that will automatically come up in your head, that you have to work even harder to change that tape, to change that wiring that has told you that you're unattractive, that this person is incapable of intimacy, that they're not safe. And so the combination between your partner working really, really hard to rewire his brain, and learn, okay, these are unhealthy ways to deal with my discomfort or my pain or my struggles, and I need to replace them with better ones. You need to be really curious about your experience too. Why am I feeling this way? What's actually happening right now that makes me not want to be intimate, not connect? And then usually the courage part comes where you have to kind of verbalize that. Sometimes because it's a couple issue, right? That you're not feeling safe with him. You're not feeling like he is attracted to you, like you are a desirable person. And so shame, if you watch any of my shame stuff, those are shame tapes in your body that are wired up pretty hard. You have to kind of verbalize it, be curious about it, and speak it out, because hopefully that partner has done enough work on the other end to say, no, that's absolutely not the case. I've always been attracted to you, and my attraction to you has nothing to do with why I would go out and act out in the way that I would act out. That wasn't an attraction issue. That was like an impulse issue and a obsessive compulsive kind of tendency that I needed to do it. But those tapes have to be rewired and reworked, and the combination of you including your partner into that reparative process and pattern also creates healing and vulnerability and intimacy between you guys.
And I'm thinking that's the intimacy, is being vulnerable and being curious. And, you talk about the story I'm telling myself. So the story I'm telling myself is that you're looking at everybody else outside, and then you come home to me and I'm feeling shame. And, we want to re-engage in sex, but we don't know what that will look like. I was also thinking, as I was reading this, that I suspect you're in the under a year and a half time frame from discovery and him working on all this and everything, because understandably, it takes time to rebuild trust, and to, like you see evidence that he's doing what he's supposed to do. Great. But it, like Kristin is saying, it's still hardwired that, oh, but he's not safe. He's not safe. Understandably,
Yeah.
it's going to take time for you to go, I think he's, pretty safe with this. I'm not trusting him with everything, but I think with this, I can trust him. So, but communication, having, Dr. Rob talks often about having having a set time, every week, or a couple times a week, or this is when we're going to talk about this stuff. So that it's it isn't just coming randomly, but it's like, this is a time to talk about us. This is a time to talk about, these issues. And we're going to carve this out so that we both come prepared to have this discussion in an open way, so that it's, conversational. I'm, the story I'm telling myself, I'm curious about this, or, here's how I feel about this, where it isn't just, raging or, but creating that safety, for each of you to have a voice in that. That's intimacy to me, is having those conversations. So.
Yeah. And so emotional and intellectual intimacy can come before sexual, physical intimacy. And then safe touch intimacy can come before sexual intimacy, right? So maybe you don't feel safe to have sex with him, but you might feel safe for him to hug you or to rub your back. And there has to be a discussion about that, that maybe his cue for is like, okay, you're feeling insecure, you're getting triggered right now, your stuff's coming up, which is very common and very normal. And sometimes he needs almost a recipe or a formula for you to give him to say, when I'm in this state, I need to be left alone. Or when I'm in this state, I need a hug, or I need you to talk to me about that, or rub my back, or hold my hand, or go for a walk with me. So it's really important that, you start figuring out what helps your body feel safer. And then you kind of have to explicitly create a roadmap to that person to help him, because he's never done this before. He or she, they've never done real intimate, vulnerable connection. At least not with like the lies and stuff going on. So there has to be an understanding. I think it's great that you can verbalize it, that this is happening and you're aware of it, which is magnificent. And so now you just have to kind of start thinking, okay, what does help me feel safe? What brings me to a better place once I notice that I am getting triggered and struggling?
So someone writes, and oh, good. Can you imagine how many calls I'm going to be returning after this? So I was muted while I could be. Okay, so this is, thank you for the overview of the levels of care. I'm a psychiatrist, so 20 years of experience, even trained residents at multiple medical schools. However, the level of training in general psychiatry residencies is woefully inadequate for treating sex addiction or co-occurring disorders. Because of insurance reimbursement, psychiatrists are often the only exposure to treatment that patients have access to. What academic paths can psychiatrists take to be able to accurately diagnose and refer? That's a great question. But my experience, even with, LCSWs, Dr. Rob is an LCSW, I hear regularly that therapists, the training in addiction is small, and then training in sex addiction is not there, and think about intimacy and everything is such a huge part of our beings, it feels like a huge miss. So thoughts on that particular one?
Yeah, well, don't forget, they can, just like therapists and psychologists, they can get certifications in, sex addiction training of some kind, or work where there is an expert in that, right? Like I thought I knew addiction in general. I was well trained in that. And then I started working under Rob Weiss, and he showed me the world of sex addiction and trained me in that. I would have been woefully unprepared to properly assess and diagnose and treat clients without that specialty of training and experience. So I always think it's all about working in a mental health collaborative environment and influencing each other, right? So we might have a trauma at my residential treatment center. We have psychiatrists, and they're very, very well trained, very intelligent people. But it still is our job as clinicians to say like, well, hey, he or she also has expressed a pattern of having sex, regular. Yes, I know you want to say bipolar, mania, and that's why that person's sexually acting out. But there's a consistent pattern here that might be a sex addiction and intimacy disorder. And they're supposed to kind of chime in with their perspective and their challenging of the way another clinician might see the problem, because that might change the medication that they use, the type of treatment that they apply, etc. So I think it's all about being in a holistic environment where there's multiple people with different opinions, and you guys all are in settings where you can challenge one another and say, I just don't see it that way.
So Dr. Rob has a professionals group that meets on Tuesdays. And for this person, if you want to learn more about that, reach out to me, Tammy, Tami, at seekingintegrity.com. But that's exactly what this group does, is they bring cases and stuff. And yesterday, the two clinicians that shared cases, their energy was so high around those cases, and other therapists were going, hey, wait, so their willingness to step into that, and B, to have the collaborative, feedback on that, particularly, for those that are in private practice, it really is a rich environment. And, I got to tell you, for the therapists that attend that, when someone's looking for a qualified therapist in their area, if someone is in that group, they're active learners. They want to do the best job for their clients. They aren't pretending, oh, I got this, I'm all good. It's very different. So they're the first ones that I refer to. So
such a good point.
So there's another one in the chat. I recently discovered that my partner, who had been in initial recovery for about 4 months, also has co-occurring addiction, chemsex, that was never addressed in traditional. That's so typical. So it was never addressed in addiction rehab treatment. This is a 10-year addiction he has had. He seems to be taking steps to best gear himself for recovery. I question just how much of my own turmoil, hurt, and fear I have at this time. You have just provided some good insights that are also address this. So
this is such a problem. You're going to hear my extremely biased opinion, but I personally would never attend a residential treatment center without someone who specializes in intimacy disorders. Because remember, addiction in and of itself, or oftentimes chronic mental health struggles such as depression and anxiety, are all just symptoms of the fact that you have really, really unhealthy relationships with other people. So in the most extreme ways, so you just sexually act out, you pay for sex, you have pornography addictions, and that's the way you kind of eat peanut M&Ms to stop feeling hungry, because you don't know how to act with people in a healthy, intimate, vulnerable way. Or you're experiencing lots of depression and anxiety because, you love this partner who seems to always be disconnected from you, or you feel depression and anxiety because you're constantly acting out or flirting with or engaging with other people to get your needs met in a different way, lying, sneaking around, etc. So I can't tell you how often I will get clients that will be on their third treatment for suicidality, let's say, and I'll talk to them and find out they've had an I just think of this young client. He came in because he has meth addiction and he's really, really sad. And that's all the clinicians know. I talk to him, I find out he's had a pattern of regularly acting out with the GPS. So he goes out and he does these really dangerous, really physically destructive ways of meeting other men online and sexually engaging with them, but in a way that's been very dangerous to him. Under the influence, he's lost his jobs, he's gotten kicked out of school. So yes, meth addiction and extreme depression are parts of it, but the behaviors have to be talked about and incorporated and understood and discussed. Like, he had no idea. It's amazing, our ability to defend our egos, to not really look at these behaviors.
Compartmentalize.
I'm constantly, and the biggest problem, I'll just say this for a lot of therapists, because by the way, I was this therapist until I was trained in this way, is we don't want to go there. We don't want to ask how many people someone's had sex with lately. We don't want to ask if maybe your wife's actually having an affair, because this is interesting behavior that's happening that's not making sense to us. We don't want to ask those really tough, uncomfortable questions, partly because I think we don't know what to do with them once they answer, but partly we're just a society that kind of tiptoes around sex. But when we're talking about mental health stuff, you got to go there straight, head on, talk about it. and go from there. So yeah, I'm sorry that's happened.
Yeah, and we hear that all the time, and we don't just have a track for this or a track for that or a group for whatever. We're looking at those co-occurring addictions and the mental health aspects holistically, and that's what we have seen to be successful for these guys. So the final question that we'll take is any suggestions on how to approach conversations around getting the most appropriate care when the addict is extremely defensive and averse to these conversations?
Well, I mean, first, like I was saying about the brain science, that we learn best under stress, and fear and concern of losing something will make us hyper focused, right? And so that's really important, is to assess their, and actually, addiction therapists are trained in what they call motivational interviewing. And it's kind of this process of challenging clients to kind of help them see that one of their best friends, they're acting out behavior or their substance of choice, that's like what their best buddy. They don't want to let go of it, but it's helping them see that it really actually isn't their best buddy, that it's destroyed more of their life and their relationships than they ever really wanted to realize, not to mention the physical damage. And so I think it's sometimes you can go maybe as a couple there, as a couple initially, like, hey, let's go to a couples therapist to talk about this. Hey, I want to go to a 12-step meeting. Will you come with me? But sometimes it's also just, figuring out how to draw the line of if you feel like this person is a concerning, unsafe, unhealthy person that's negatively impacting your life, I think you got to say so. You have to share the way that his or her behavior is impacting you, are impacting those that you care about, and what you really need to see them do so you can feel safe with them again.
And I think often coming from the approach of, I'm really concerned about you. I can't sit and watch you destroy yourself. It's hurtful to me. I really care about you, but we get so many clients in treatment who are, have those boundaries. There's a negative consequence, and they may only come because their relationship is in danger. Once they get there, and we help them, like you talked about with the motivational interview, but we help them unpack what's really going on.
Right.
They can get it, but initially they might just be coming just to, I don't want that negative consequence. So addiction, like you said with the brain, it's like, it's so ingrained, and it's like, I'm going to keep doing this as long as I can. So until the consequence is more negative than the need to change, which I find negative. I don't want to change. I don't want to change. I need to keep this, but now this consequence is even worse. Okay, I better change. That's, typically what happens. But I really, I've seen a lot of success when people come at it, with love and caring. It's like, it's not this is this. It's like, you are hurting yourself. Here's this. And, that's not okay for you. I worry about you, but it's also affecting, every other aspect too. So we're out of time. Thank you, as always, Kristin. Thank you to all of you who joined us and gave us these great questions and feedback. We appreciate it. You can find Kristin at kristinsnowden.com, right?
Yep.
Okay. I was going to say, I should know that, but I only see you once a month, so it's harder to remember. And I do get, as you mentioned, I have lots of people who write to me and say, Kristin Snowden suggested I reach out. So reach out to her, reach out to me, whatever. We want to help you get the right resources so that you can be successful on a recovery path. So
thank you so much, everyone.
Thanks. Bye-bye.